Hello, my dear friends. I, Dr. M.K. Maheshwari, presenting a new video of the Marrow Question Bank review. As you know, due to the demand of the variety of the students, I'm going to present this video. As many of the students are confused about this thing that whether the Marrow Question Bank is good for them or not good. Variety of confusions are there. So I'm here to presenting a frank review of this. So without wasting the time, I'm going to start the review. First of all, I thought that they consist of the highly selected MCQs with more than 60% of the clinical questions based on the recent trends of the examination. Also, the question bank is updated with the lengthy clinical scenario questions. This is the good part that they are updated with the lengthy clinical scenario questions, because some of the students are saying that the explanations are very lengthy, but sometimes it is the demand of the question that you have to read some lengthy explanations, because it may cover in the future some more questions. So this is very important. It also is a separate module with previous years of the aims and NEET questions. So what is important in that if you are customize the thing, like if you have to do only aims question, then you are free to do it. If you have to do only NEET PG questions, then you are free to do that also. The question bank also constantly updated with the recent updates, including the changes in the new editions of the textbook, which are very likely to be asked. This question bank also has new in-depth and tricky questions, which are important to keep us ready to face any kind of the exams. It also consists of more number of the image based, including the GIFs also, which is very unique as you compare to any other platform. The explanations are fabricated in such a way that it makes us clear the concepts and have a very good understanding of the topic. They also contain the illustrations and clinical images to get a clear understanding. Also, the relevant pearls are attached to the explanations, which help us to understand the relevant topics. So just try to solve the question bank every day and do not skip even one MCQ in any module. Make sure that you attempt every question whether you know it or not know it. This is very important one. Try to solve the question bank every day. This is the conclusion of this. Marrow recommends minimum solving of the 5 modules every day. They also run the contest like a marathon, which motivates you and keeps you going on and on. The question bank tracker feature in the app keeps track number of the modules solved every day. So thus it helps you to keep track of your preparation, that at this particular point of the time, where are you in your preparation. So this is also very important. You can solve the question bank in two ways. Firstly, like immediately after watching the corresponding video modules. Second one, you can solve the question bank modules independently of the other factors like your classes or level of preparations. This method is also highly efficient as it will improve the retention capacity of the student. Another cool feature is the bookmark option. I personally like it. This bookmark option is a very nice one. There are 3 types of the bookmark options available: the routine bookmark, star, and question bookmark. You can use it to prioritize the question based on how important it is and how often you would like to review those questions. Now remember, do not exploit the bookmark option. Do not mark every question, as it will increase your burden during the revision times. So make sure to review the bookmark questions every single day and keep clearing it when you are thorough with it, when you are going to thoroughing with it. Also try to make notes from the question bank. Also again, I just one focus one point that do not note down every single point, as it will again make your revision very difficult. Just try to catch important high yield points. This is very important. Custom modules options also have added advantage. They have the option you to create a scenario of your own choice. The tags available, make sure to use tags like hashtag recent updates, hashtag aims, hashtag recent NEET, hashtag image based. So whatever variety you want to solve, just do it and solve it. Solving these type of questions before the exam is very good. The custom module can be a perfect tool for the revision part. Yes, my dear friends, as you know, revision part is very difficult, but if you do by selecting the custom module option, then it may become easy for you to revise the things. So by considering all these points, I personally thought that Marrow Question Bank is one of the best in the country because of its standard and authentic questions with brief explanations. So now, uh, again, I'm here to present some of the slides which practically helps you to understand how how can you use the features, right? So just watch it carefully. So here you can see the new custom module option. By setting you the difficulty level, either you can select all, or you can choose your level as per your choice. If you want to select the questions from all question MCQs, or bookmark question MCQs, incorrect question bank MCQs, attempted question bank MCQs, unattempted question bank MCQs, so you can do it accordingly. Also, you can select the number of the questions like 10, 25, 50, 100 as per your time permits. This is very important. Also, you can select the tags. In the new custom module option, you can select either hashtag aims, either hashtag numbers, hashtag the commons. So as per your revision plan, you can select your tag. you know Hashtag drug the choice, hashtag investigation of choice, you can do anything. So this is also very important. Now you can bookmark some important questions. Also, you can see the importance of that particular question, that how many percentage of the people got it right, got it wrong. So you can analyze your level, that if this question you will do right, that at this particular point of the preparation of the exam, where are you? So this is also very important. So you can bookmark, you can use this bookmark option. This is also very important. Now some of the image based questions, if you watch it carefully, at which of the following parts are not drained by the thoracic duct, then see the explanation part. See the explanation part of it, like the lymphatic drainage is done by the right lymphatic duct of the right upper limb. This proper explanation is also given. Now, this image-based question, you can see that an 18-year-old girl presented with scissors, and her radiological image is given below. Knowing the MR spectroscopy of the lesion showed elevated choline, alanine, and lactate, which is what is likely the diagnosis. So there are four options, and see the clear-cut image of the problem is there. So you can select it accordingly and solve the image-based questions also. So that is what the thing. So after watching the slides, I hope you will understand all the important points, that how to mark everything, or how to do the custom module option, everything. So if you have any query, you may post it in the comment box. I will reply you soon. Thank you.